deciding to receive the vaccine, deciding, still contemplating, those who administer the vaccine, so on and so forth. So we're going to jump right into it, if you guys don't mind. Just wanted to, as we are coming into the space, do a couple of housekeeping things. The first thing is that we do have interpretation. This is a multilingual space. And so Maria, I'm going to pause and let Maria explain to us more about how that works and how you can choose your interpretation and language options.
Thank you so much, Joy. So I will need to share the screen if you don't mind. Whoever is sharing the screen, give me the option to do that. Okay, thank you so much. So thank you so much for coming today. As we stated, we're gonna have simultaneous interpretation services today for people who are joining us and speak Spanish. So please read the information that you see here. Hold on a minute, I think it's loading. Can you see it? Can you see it now? Thank you. So as I say, we will be using interpreting during this meeting. After joining the meeting, choose the language that you would like to hear, whether it's English or Spanish. And for that, you have an icon at the very end. Close where you see the chat icon and the options to emojis and more. So please, you just go ahead and you can use it right now. The interpreter is doing it. If you are using the computer, please just follow the instructions that is in this PowerPoint presentation. As I mentioned, it's mostly just get the icon. If we have someone who speaks Spanish and feel more comfortable speaking Spanish, please just go ahead and do it. And I will request the English speaking people to just click on the link where you can use the English version. Okay. This is just the information, same as in Spanish. All right, thank you.
Thank you, Maria. So yes, if you would like to choose your language, please do so at the bottom of your screen. It may look different if you are on a cell phone, but on a laptop, you should see something that looks like a globe and you can choose your preferred language. Okay. So today our conversation is for information purposes only. We are going to take some time to ground ourselves. We are going to suspend judgment. We are going to tune into our curiosity. We are going to do our best to listen and to learn. And to ask questions in this space. This is going to be a brave space, so we're going to encourage people to speak up with their opinions and with the information that they have. And with that being said, there is not going to be any blame in this space or any shame in this space. And so if we can keep reminding ourselves of the purpose, which is to present and receive information, we are creating an educational opportunity to help people, especially as folks think through their decision to receive a vaccine, booster, or do other things to protect themselves against COVID. So hope that is good with everyone. We are going to kick off this conversation. Question: do we have any poll questions ready for folks? Cool. So you guys should see a poll that came up on your screen. This is just to help us get a better idea of who we are and who we are speaking with. So if you could please take the time to answer the questions that you see on your screen. Have you decided to be vaccinated? Are you an any of these perinatal stages, and who are you most interested in getting this information for? We will leave the poll open for probably about 10 more seconds. As you guys read through these questions. And we'll just take a few more seconds to let everybody finish up those poll questions. And let's close the poll. We should all be able to see the results. Okay. So in our group, majority of folks that we're speaking with are vaccinated, are not currently pregnant, or just experience postpartum or planning for family. And a lot of people are here to gather information for various reasons, for themselves, their work, other people in their family, and for the community. So thank y'all for that. That's good information for us to know. I am going to turn back over to Maria Padilla to give us a brief overview of who Born in Durham is. Born in Durham Healthy for Life is a coalition here in Durham. So I'm going to let her explain for anyone who might be new to the space who we are as a collective.
Sorry, thank you so much, Joy. So yeah, I'm glad to present the Born in Durham Healthy for Life. As Joy mentioned, is a coalition of local agencies, community-based organizations, academic institutions, and stakeholders. And we focus to reduce the maternal and infant morbidity and mortality and improve perinatal equity. Our mission is to eliminate bias and systemic racism and perinatal health. And so Born in Durham Healthy for Life improves collaboration and cooperation among organizations, communities, and institutions to enhance the efforts of all committed to perinatal health equity. So our goal is to have more members in the community invited to be present in our meetings that happens every month at 4 p.m. We use the Zoom platform, and we can share the link with you all because we're interested to know what the concerns of the community are. And we are planning to create several events for now on to the community. So we would like to hear from you. What are your concerns and what topics would you like us to address in regards to pregnancy, perinatal care, and to help the community to get more informed as this event that we're doing today. We are also planning to have an event because we know that we have different people all over this community in Spanish, where we wanted also to address the concerns that the Latino community have here in Durham. And for that, we will have another event similar to this one in Spanish. And we have actually the simultaneous translation in English because we also think that the community needs to be heard from different perspectives or different organizations as well. So thank you for coming. And again, we are open to and welcoming to everybody to participate in this event and other events that we have in the future, and especially the meeting we have every month. This is the third Tuesday of every month at 4 p.m. Just I will put it in the chat as well. Thank you.
Thank you, Maria. And if you would like to also put your email address in the chat box, if anyone is interested in joining the Born in Durham Healthy for Life Coalition, if you could please send Maria an email, or if you're interested in getting more information about the events and meetings she mentioned, she will be able to send that information to you as well. So we're about to hop into our panel. First, we're going to hear from Nurse Hattie Wood to hear more about opportunities to learn more about the vaccine here locally in Durham and opportunities to receive the vaccine or receive the booster. Nurse Hattie serves as the Director of Nursing and Medical Services for Durham County Department of Public Health. She's been a nurse for over 40 years, born and raised in Durham, has worked for Durham County Department of Public Health for over 25 years, and is really passionate about public health and continues to work in public health as a means to give back to the community. So thank you for your time, Nurse Wood, and we are here for you.
Thank you so much. So I want to give some information currently about the data that we have from public health. And there's a train going by, which you probably can hear. Public health here at Durham County. And just some data, I'll give you some data, and then I'll tell you about the events that we're doing here for COVID vaccination processes. So as of this morning, Durham County has had 35,194 total cases of COVID disease, and we've had 257 total deaths and 240 cases reported in public health within the past 7 days. Our usual 7-day average moving is about 34. It's been declining since September, and we're very happy about that. So last week, our positivity rate is down to 2.6%, and it's been declining also since September, and it's been below 5% since the week of September the 12th. And 5% is a significant CDC metric to meet. So Durham has now moved from a high transmission community to a substantial transmission earlier this week. That's good. In reference to outbreaks of COVID in Durham, we currently have 3 outbreaks. We have 2 in a shelter congregate settings and 1 in a nursing home. And then we have to talk about clusters of COVID, active COVID diseases, where you have a group that's in a specific locale that are positive for COVID. We currently have 9 clusters of COVID. There are 8 in the K through 12 schools, 8 clusters, and then there's 1 university affiliated. So I also want to talk about the breakthrough cases of COVID. I'm sure a lot of people have heard about, people being fully vaccinated and then still getting COVID. So this has been ranging from 15 to 30% since we first started tracking that in July here in Durham. During the month of October, 30.11% of our cases were breakthrough cases. An increase in this metric is to be expected as most of our population moves to being fully vaccinated. You can get breakthrough cases, but in general, we are seeing fully vaccinated cases are less symptomatic, less severely ill or hospitalized, and it decreases their risk of death. Unvaccinated individuals are 4.5 times more likely to get COVID-19 compared to vaccinated individuals. And unvaccinated individuals are 5 times more likely to die from COVID-19 compared to vaccinated individuals. So we talk about Durham, and these are some of the stats according to North Carolina DHHS for Durham County. Fully vaccinated percent of our population in Durham County, 65% are fully vaccinated. And our 12 years and older population, 75% of that population is vaccinated in Durham. Now, so we just got our standing orders last evening from the state, and it was an executive order from our executive, Dr. Tilson. And so we will begin the pediatric vaccinations in Durham County. We got our supplies in, we got our ancillary supplies in earlier, we got our vaccine in yesterday, but we could not begin to administer here at Public Health until we have the standing orders. So I'm happy to say that we got our standing orders signed today, and we're training. It requires a specific training when you talk about vaccinating 5 to 11-year-olds, because they can be vaccinated in other sites besides just their arm, their thigh as well. So we're doing the training for our vaccinators, and at the health department, we're looking to start vaccinating our 5 to 11-year-olds on Monday. I heard at the health department Monday, November the 8th. and we will do them. These vaccinations will be available in limited quantities for walk-ins. And we're going to take appointments for those, and there can be 19 appointments for children. Those will be appointments because we're getting vaccines in waves from the state with the amount of vaccine they're sending. And we also will do them as walk-ins too, or appointments. And you can call and get an appointment. I want to take in a note that we also have 2 outreaches this weekend, starting Friday. There'll be an outreach at Voyager Academy from 3 p.m. to 6:30. We're going to be vaccinating children 5 to 11 with the Pfizer, and we're going to be giving all 3 of the vaccinations: Pfizer, Moderna, J&J for first, second, third doses and booster doses. And then on Saturday, there is a partnership. There's a big event at the Durham County Memorial Stadium, and we are working with other partners, and we will be administering Pfizer to the 5 to 11-year-old pediatric vaccines, and we'll be giving Pfizer, Moderna, Johnson & Johnson first through third doses and booster doses to all eligible individuals. And that event is from 10 a.m. to 1:30 p.m. So we pretty well, and our COVID vaccination clinic continues to be open Monday, Wednesday, Thursday, 9 to 4. On Tuesdays, we have late clinic from 9 until 6. And so we have people that are severely immune compromised are eligible to also get a 4th dose if indicated. That recently came down from the CDC and from the state as well. A 4th booster dose for that population group. And so if you're interested in data for Durham County, and it should be in the chat, you can look on there and it'll tell you the information. You can go to our data hub, and I just looked at it myself. And on that, if you want to look at race and ethnicity, in one of our data in our hub, it lists the vaccinations for people of color. And there's a reading on there as to why we designate that population, because that's the lowest uptake of COVID vaccination. And we want to be able to reach those marginalized populations and the areas that we need to go into for our outreach and this at-risk group. We also have in the chat the testing sites where you can get tested for COVID, and that's listed also. And then also our clinic vaccination schedule is in the chat also, and you can just click on those links, or you can go to our public health website and find the same information on our COVID page. And that's about all I have today. Thank you, unless there are questions.
So thank you, Nurse Hattie. We did have one question, but thank you for that information. That was very helpful. That information is in the chat, y'all. And again, we'll try to save that chat. Reach out to us if you need more information. The question we have is, could you please elaborate a little more about what exactly are breakthrough cases?
A breakthrough case is if a person has been fully vaccinated. Not necessarily if they've had the boost, but if they've had the series as indicated, whether it's the 2 or the 1 J&J, and then they still end up with COVID later. That's a breakthrough case. It's breakthrough vaccine. We need to take into context that the COVID vaccination is not a cure. It is considered that it will decrease the possibility of you getting severe disease, ending up hospitalized, or death. And that's what the COVID vaccination is for. It doesn't stop you from getting COVID. That's why we still have the measures in place of the mask and the social distancing at this point. And then as our positivity rate goes down, then the state will look into, and the county, as to what the guidelines would be for masking and social distancing as well. So that's what a breakthrough case is. They break through the efficacy of the vaccine.
Thank you. Thank you for that. So we did have another question about the child vaccines. I'm going to ask that question in a little while. And we're going to move on because Nurse Will, you gave us a nice segue to say, why are we, looking at Black and Brown and communities of color? We have Mr. Cornell right here with us. Serves as the executive director of the Office of Minority Health and Health Disparities, and who is a subject matter expert just on that very issue, areas around health equity and the intersections between that and racial equity and health disparities. And would like to invite Mr. Wright into the conversation to talk to us about why are we putting an equity lens on this pandemic and on the vaccine conversation?
Well, thank you for that question. Thank you for having me. I think as we get into this conversation, equity is so important to name it and to say what it is. When we talk about equity, especially in health, we're talking about the ability or the opportunity for people to experience and sustain good health and well-being. Those unfair differences that prevent that from happening, we call the health inequities, and the way we measure it all by comparison of outcomes from one group to another or one thing to another, we call those the disparities in terms of what we see in that measurable gap or distance between that comparison and the outcomes. And so why is that important? It's important because when we start thinking about drivers and determinants of health, or those things that can greatly influence the way we live, work, play, worship, and engage with one another and others, it's, you know, this lens of fairness that sometimes is lacking in terms of making sure we meet people where they are. And when we looked at this conversation over a year ago, when it first started at the beginning of, for us, most of us, it started the day the NBA shut down in March of 2020 on that Wednesday night. It just changed the world. And so what we were being asked then was so much different than what we're being asked now or what we see now. We were literally in a conversation with faith leaders in Durham. And I remember my boss and I at the time, Mr. Ben Money was in there talking. He was literally physically there and I was on Zoom. And the question came from some of the clergy of, you know, can Black people get COVID? Because at that time, we hadn't seen a lot of us getting COVID. And I had to remind them in the call, it was like, you know, the NBA is predominantly Black and they shut down because a lot of their, you know, players were getting COVID. And so sure enough, as we start looking at the data, we start looking at the numbers and breaking down the percentages, we were seeing that upwards of 40% of Black and African Americans in the state and over 40% of Hispanic, Latino, Latinx community members in the state were being infected with COVID. When we start looking at the death rates, it was very similar for the Black African American community, but less than the Hispanic, Latino, Latinx populations. But the problem was, if you're seeing the percentages of upward of 30, 40, close to 50% in your positivity rates and your death rates, that's a problem because Black and African Americans in the state make up about 22, 23% of the total population. So we're seeing that unfair difference there. We're also seeing that our Hispanic Latinx community makes up about 9 to 10% of the total state population, which may be changing based on the new numbers from the census. But we were seeing, you know, extraordinary disparity numbers there. And so it's so important to put this lens of equity, this lens of fairness, and making sure that people get resources to be able to not only survive, but thrive while doing so. And a lot of times the conversation has not always been in our favor to be, you know, accessing those resources. And so a lot of the work that we've been doing has been leading with equity, earning, building, sustaining trust in communities across the state, not just in our Black and African American communities, not just in our Latinx communities, but also North Carolina is unique that we have, you know, American Indian, Alaska Native, you know, and other Asian country origin community members here that live amongst us. And so North Carolina, you know, just alone with the way we have our military bases in our colleges, you know, spread out, we have just an overabundance of different types of people around us. So we have to make sure that there's communication equity and fairness in this conversation. I'm so glad that Dr. Viviana just jumped on because she has been fighting so hard for all of us in these spaces, not just for the Latinx community, but making sure that she is fighting for people in the community, period. And we need heroes like her in this work that we do, and all of us can do our part. And so when people have the opportunity to be engaged, to be involved, we want to make sure that they have the right tools and resources to do so. So one thing we do ask is that you get the information, that you make informed decisions, and because we want to make sure that if you can get vaccinated, we would love for you to do so. There are also other treatment options, whether you're vaccinated or not, like the monoclonal antibodies that exist in terms of helping to reduce severe risk and illness, hospitalization, and possibly death, if done so in a timely manner. And so getting that type of information in our communities has been so critical. But I'll stop there because there's so much we can talk about, and I don't want to, take over anybody's thunder in that sense, but here to answer any questions that I can, especially if there's questions about any of that or anything I didn't mention, including how we're putting out the information and resources for 5 through 11 vaccines. I know my daughter is in Durham, and her school is going to have a vaccine clinic next week. So that's just another opportunity for us to engage in stopping the spread of a deadly virus that's really been plaguing us for almost 2 years now. So thank you for having me.
Thank you so much for coming, and thank you for grounding us in why it's important to have an equity lens. And you said a couple of really important things that's really relevant. I'm gonna tap into Dr. Maria Small, who is born in Durham, coalition co-chair, and working in maternal and fetal medicine. And I'm wondering, like Mr. Wright said, it is important for us all to do what we can, to stop the spread and to prevent ourselves from getting COVID. But like, what is COVID? What's the state of it? What is it doing to our bodies? And then maybe we can go into some of the ways that we can kind of prevent it.
Thank you so much. And thank you everybody for being here. I think, sorry, can you see my screen?
Yes.
That's not what I
Dr. Small,
wanted to
maybe
show.
we need to change the screen or full screen. To full screen, there you go.
Is that good? Is it,
Now it looks perfect, thank you.
all right, so I had to make a few slides. I'm gonna just go through. I think most of us have had quite an experience with what COVID symptoms are, but I put them here just to review: fever, cough, muscle aches, sorry I'm going fast, breathing trouble, headache, diarrhea, and then more recently or later in the pandemic, we realized loss of taste and smell. These symptoms can happen very quickly, progress to pneumonia, respiratory failure, and as we know, even result in death. Pregnant women are not necessarily at a higher risk of getting COVID, but pregnant individuals are at a higher risk of getting severe complications from COVID. And as you all know, we have 3 available vaccines in the United States and the boosters, and all of those are recommended by ACOG, which is the American College of OBGYN, SMFM, which is the Society for Maternal Fetal Medicine, that's the high-risk OBGYN doctors, and the Center for Disease Control. And we're going to talk about this a little bit more, but this is recommended for individuals who are pregnant, postpartum, or considering pregnancy. These data are from a large study of multiple individuals, pregnant women who had the vaccine and actually, those who had COVID in pregnancy compared to those who had who did not have COVID and were of the same age group. So pregnant women who had COVID and pregnant individuals who were not pregnant, but who were in the same age range, in the same kind of city, hospital, similar conditions. If individuals were pregnant, they had a higher risk of preeclampsia, eclampsia, which is the hypertension symptoms and syndrome of pregnancy that, if not treated, can result in severe complications like seizures, like stroke, and worst case scenario, it can be a cause of maternal mortality. Individuals who were pregnant with COVID had a higher risk of severe infection 3 times, higher risk of ICU admission 5 times, and maternal mortality is 20 times higher in individuals who had COVID and pregnant. So the risk of severe illness, preterm delivery, and death is also higher for Black and Latinx pregnant individuals who had COVID-19. So that's part of the reason we're talking about this. Someone said the pandemic highlighted the cracks and the light shines through the cracks. As was mentioned, COVID-19 disproportionately affects people of color. In Louisiana, about 70% of the deaths were in Blacks. They were 32% of the population at that time. Michigan, 33% of the cases among Blacks and 40% of deaths. And as was mentioned, some of the drivers of these differences can be the type of work that we do, access to care, access to transportation, access to housing, stigma, isolation, and in pregnancy, a loss of social support may contribute to these outcomes. And then I put what I consider some of the light: community, doula care. In North Carolina, we have pregnancy care managers. We also have community navigators who have helped to improve outcomes and improve the health of communities in North Carolina affected by COVID and at risk for COVID. And I feel like all of you in the room, that's why I add to the light in this conversation. So pregnancy and the vaccine, this is from the Center for Disease Control, and this is from a few months ago, but the numbers are very similar now. 16% of pregnant women in their vaccine safety data link were reported that, well, 16%, this is of 16% of pregnant women in the CDC vaccine safety data link. So of these individuals, they had at least one shot. And if they got Pfizer, Moderna, the RNA vaccines, you know, it's a 2-shot series. Johnson & Johnson, it's a 1-shot. So non-Hispanic, Latinx, Black women had a 6% vaccine rate in pregnancy. Hispanic, Latinx individuals, 11.9%, Asian, 24%, and white women, 19% rates of vaccination in pregnancy. So overall, vaccine rates were very low. And this is from December 2020 to I think May of 2021. And this is from a colleague of mine. Pregnant people with symptomatic COVID have about a 70% increased risk of death. And at the time of this, this is more recent, only 30% of pregnant people have been vaccinated against COVID-19. And then the text on the left of hospitalizations, and this is a more recent, probably around representing more that variant of COVID that we all are familiar with now, the Delta variant. Of the hospitalized individuals, 97% were unvaccinated. So we're asking the question, I am pregnant, lactating, breastfeeding, considering pregnancy. Can I get the COVID vaccine? Yes, and it's considered safe for you and highly recommended. The COVID-19 virus actually increases the risk of severe complications during pregnancy. The vaccine is not associated with infertility, birth defects, or miscarriage. It's not a cause of decreased sperm production. And there's actually been studies looking at the sperm count, the quality of the sperm after vaccination compared to individuals who are not vaccinated, and there's no difference. There's been questions about whether vaccination may affect menstrual flow, cramping, things like that. These are not, quite honestly, definitive, and there is a big push to get more information. But again, those reports are small, but we still want as much information as we can. And what about COVID-19 vaccine and my baby? The vaccination may actually benefit your baby. We know that the antibodies that are produced by mom cross the placenta, and they actually can help the baby to have some immunity against COVID-19. We also know if there's breastfeeding, we have antibodies in the breast milk that may also, just like any other antibodies that the mom may produce to help babies fight infection early in life, may also benefit the baby. Now, the other thing we alluded to, whether you're vaccinated or not vaccinated, I have COVID and I'm pregnant. Can I receive the monoclonal antibody? Yes, you can, because the monoclonal antibodies, they're actually antibodies that help fight against the COVID virus, and they're given to you in an infusion. So if you are pregnant, you're in what's considered a higher risk group for complications of COVID, and you are able to receive the monoclonal antibodies, whether you are vaccinated or not. And then these are other questions, but we can talk about those later. So with that, I'll stop there and say thank you very much for your attention.
Thank you, Dr. Small. That was very informative. Again, y'all, I'm going to keep our agenda rolling, but if you have questions, you can either put it in the chat or use the Q&A feature. We've received a lot of really good information here. I'm going to go back to a question that we received earlier. We have Dr. Ellie Erickson on the line here with us, pediatric doctor at Duke. We received a question earlier, Dr. Erickson, around the experience of children who received the vaccine. They were wondering if the side effects were similar to what we saw adults experience. And if you don't mind, can I put you on spot a little bit and start the conversation off there? We had Nurse Hattie Wood explain to us where the vaccines and boosters were available, where kids could go and adults to get it. But now we have folks wondering, like, what is that experience going to be like for our children?
Absolutely. Those are great questions. So to start, I will just say that the pediatric community is overwhelmed with joy to be able to have these vaccines available for children ages 5 to 11. And we are anxiously awaiting approval of the vaccines for children under 5. I personally, as you may see from the crib behind me, am waiting anxiously for my children to be in the group who are eligible for the vaccine. So to answer the question about whether or not children experience similar side effects to those that adults experienced, the answer is yes. The vaccine for children will be a 2-dose series, just as it was for the Moderna or for the Pfizer vaccine for grownups. And we do expect that children will experience similar side effects that adults experienced when getting their vaccine, feeling tired, having a sore arm, sometimes experiencing low-grade fevers. All of these side effects are anticipated effects of receiving a vaccine. I hesitate to even call them side effects because they are anticipated effects of receiving a vaccine. If your children received other vaccines when they were young, you may remember your pediatrician having told you your baby might be a little fussy, might be a little sleepy, or might have a low-grade fever after their routine vaccines. Those are the exact same effects that we all experienced receiving the COVID vaccine as grown-ups, but we know that grown-ups are generally a little less tolerant of side effects than our kids. I have to say that I have a new appreciation for all of my patients who are getting their routine vaccinations and the way they feel generally after getting them. Again, I hate to even call these side effects because they are expected effects of receiving a vaccine, and the way that our body is showing us that it's responding appropriately to the vaccine. And then the second question around, it was where can children?
Well, we got the opportunity to learn from Nurse Hattie Wood, some of the opportunities coming up at Voyager Academy and things of that nature. But I do see another question that says, is it okay for our kids to get both the flu vaccine and the COVID at the same time?
Yes, it's totally fine. There is no recommendation that the vaccines be separated. At one point early when we were administering vaccines, there was some recommendation that the COVID vaccine be separated from other vaccines by about 2 weeks. That's no longer the recommendation. So you can absolutely receive your COVID vaccine and your flu vaccine at the same time. And if you have the opportunity to do so, I would absolutely recommend it. As far as other places to find vaccines, you can certainly call your pediatrician's office and ask them if they are administering vaccines. A lot of clinics in the area have been getting vaccines in stock. We expect to in the next few weeks as well. And so checking in with your pediatrician as you're able. I see another question.
I think it's in Spanish. I want to say it. So, Dr. Harrison, the question is from Ms. Obregon. She wants this mom, and she also is community health worker from La Semilla. She wants to know how easy will be have access to the vaccine, not with a primary care, with a pediatrician.
So vaccines will be hopefully administered by pediatric clinics in the same way that other routine vaccines are administered. So call your pediatrician's office and see if they have one. And I see that Dr. Viviana Martinez Bianchi would also like to address this question. So I'll pass it over to her.
Thank you. So el 13 de noviembre, November 13th, Duke is having a great event where we're going to be offering vaccines for children and adults on November 13th at Wills Fun Park. From 10 a.m. to 4 p.m., there will be vaccine for kids, 5 and adults. Pfizer vaccines are going to be available for children and adults on November 13 at Wills Fun Park. Duke Pediatrics is participating, the African American COVID Task Force, Latin 19, and several other partner organizations are participating. So Patricia, el 13 de noviembre at Wills Fun Park, ahí estaremos para vacunar a todos los niños. So it's a Saturday. This is going to be a Saturday, and we are expecting to have over 500 to 600 people getting vaccinated, so you can bring the kids that day.
Gracias. I'd say gracias for jumping in.
She is she's wondering, especially for parents who are workers and they also work during the weekends as well, so they want to just know what other options they might have.
So the state is rolling out 650 sites all over the North Carolina to be able to contemplate times for people and different hours. There's also going to be vaccines available besides pediatricians' offices, vaccines available in different pharmacies. So just the vaccine is arriving into North Carolina and is getting deployed in many, many different settings to make sure that even parents who are working are able to get their kids vaccinated during hours so that they don't miss work. The event on Saturday, November 13th is hopefully will help for some people who work Monday through Friday. Parents do need to be there, or somebody has to be there to give consent for the vaccine.
Gracias. You spoke in a very timely way about what I was going to introduce you to speak about. But thank you, Dr. Viviana Martinez. Bianchi does so much work to help us with access and a lot of work with Latin 19 to specifically improve access to the Latinx community. Are there other things that you would like to let us know around the work that you're doing?
Thank you for that comment. So definitely estamos trabajando para que la comunidad latina tenga acceso. We're working so that the Latino community has access to vaccines. At every event, we try to make sure that there are Spanish-speaking people also vaccinating and people who speak Spanish at the entrance to make sure that everybody is able to have access to the vaccines, feels comfortable that somebody is going to be there speaking in Spanish, vaccinating in Spanish. So we will have in every one of the settings that we are hosting, trying to make sure that we have Spanish speakers as well as vaccinators, people at the front, and also we're working with several community organizations with Spanish speakers to be able to be there to answer these questions.
Awesome. So again, thank you so much for all of those efforts and everything that you all are doing. We heard a lot of information from our providers and from our healthcare workers and leaders around, what COVID is doing with the state of things, what the vaccination is and is doing, and where you could receive more information or receive the vaccine. Now we are going to go into hearing some expertise from our community members who have experience around making the decision around whether they want to be vaccinated. We are tight for time, and just FYI, wondering if people would lend us grace and give us about 5 additional minutes so that we can hear from our community. If you have to hop, we completely understand, but we may run over about 5 additional minutes. So I just wanted to say that. But first, we are going to hear from Maya Jackson, who is doula, also founder and executive director of MAME, a nonprofit organization here in North Carolina that stands for Mobilizing African American Mothers through Empowerment. And so they really center lived experience of Black birthing people, also providing education, economic empowerment, and doula services and doula training to our community. And so in this space, we're going to ask Maya to put on her mommy hat and her birthing person hat and share her experiences around making decisions around the vaccine as a breastfeeding perinatal phase birthing person.
Good evening, everyone. So as Joy said, I'm putting on my mommy hat today. I am a mother of 4. My children range from 13, 11, 4, and 3. With me being as active as I am in the community as a birth worker and as a community health worker, it was really important that I did my due diligence to make sure I learned as much information about the vaccine. Last December, I lost my grandmother due to COVID. And so that was one of the first things that stuck out to me of how close in proximity this virus was to me and my family. Keep in mind, as being a health worker, I pretty much distanced myself physically from my grandmother from March through September. I wanted to make sure that everything died down, and so I would still run and do her errands. She would always have me go to Sam's and pick up stuff, and I would run and get her food and I'd drop it off, and then I'd just see her from the door and talk to her. And when things calmed down in September and I knew that the risk ratio was low for me and the children, we would go in the home to visit her, but I still made sure that everyone washed hands, had their mask on. She, on the other hand, would just want everybody to take the mask off. And I'm like, nope, my rules, even though it's your house, you got to keep your mask on. And so It was when the rates started going back up again that I was like, hey, I don't think that it's safe that, we come in contact, but whatever you need, I'm here. And we just kind of went back into our routine. And unfortunately, um, it may have been, her just going out. It could have been, a family member. It could have been anything. I don't know. But after Thanksgiving of last year, going into December, she had went into a coma and succumbed to COVID. Because of that, and knowing that African Americans, and particularly folks in my family, have high risk diseases such as diabetes, high blood pressure, all of these things that I know can complicate systems, because my grandmother was 82 and she had just overcame breast cancer 2 years before COVID took her. So knowing that she was already autoimmune compromised, I started to think about other people that were around me. Now, speaking for myself, I delay vaccines for my children. It's not that I'm anti-vaccine. It doesn't mean that they don't get vaccinated. They do get vaccinated. I just don't follow the traditional schedule. I make sure they get it within the window that they need it, but I just don't like getting everything all at one time. And that's my personal choice. And so I wanted to make sure that I had time to research, process the information. I had a friend who really gave me a lot of insight about Moderna. And knowing that the Moderna vaccine had been in development, I think as far back as 2012, if anyone remembers what SARS was like back then, it was almost like COVID, but not as extreme. But I had a friend who experienced the severity of SARS, and it was, she took the opportunity to take the Moderna vaccine then that kind of helped her pull out of that virus. And so as the other vaccines started to come out, I was like, okay, well, let's see what's going on with Moderna. And so I just started to follow the data, and I started to follow the conversations from the health professionals, but also folks who just study viruses, because there's so much misinformation that was coming out about the vaccines. Some people who have PhDs weren't necessarily experts in what they were talking about. And so for me, I wanted to make sure that I found the right experts, the right providers that I could sit down with and talk to get the information to make the best decision for me and my family. And so once I got that, I went to a community COVID clinic. I got Moderna. I talked to the provider, and I was like, hey, if something goes wrong, I'm coming after you. Just so you know, I know you, Dr. So-and-so. In fact, his name was Dr. Jackson, because my last name was Dr. Jackson. So I was like, I know you from somewhere. So if something happens, I'm coming for you. But I will say the side effects that I experienced was more so after getting the shot. I didn't receive any headaches, or I guess I would say that I was lucky. I didn't experience any of the major side effects or no side effects that most people experience. My dad didn't either. From there, I had my 13-year-old vaccinated once she was approved to get it. She's now fully vaccinated. And I also live in a household with 2 people who are autoimmune compromised. And so it was like, hey, we got to do this. We've lost people. My grandmother wasn't the only person that passed away. I learned about other family members across the state passing away from the virus. And because it hit so close to home, because my work involves me being around people, it involves me being around the most vulnerable people, it was most important for me to make sure that I considered the community, not to only not put myself in harm, but not to put others in harm as well, because I want to make sure that particularly for birthing people of color, that they have someone in the room that can support them and advocate them. And if I'm not there for my clients, then I'm doing a disservice to them and to my work.
Thank you, Maya, so much for sharing your journey and your intentional process. We are hoping that, especially if folks are still contemplating, that we help to provide some information to guide you along your journey and your intentional process.
I forgot to also mention, I'm still breastfeeding. I'm an extended breastfeeder. I'm still nursing my 3 and 4-year-old. That was the first evidence set for me back in April. That was like, oh, getting vaccinated. It's actually March. Getting vaccinated would mean that the antibodies would then be given to my younger children who are now old enough to get the vaccine. This was that process that kind of got me moving forward, because we already know the powerful benefits of breastfeeding. So then you add the component of the vaccine, it was pretty much a no-brainer after that.
Thank you for uplifting that. And I'm gonna uplift that Dr. Erickson is also shared with us that she's a breastfeeding parent who wanted to take advantage of that opportunity to pass those antibodies on to her infants. So thank y'all for sharing that. I want to now uplift and call on Patricia Obregon. I hope I said your name right. And Patricia will talk to us more about her experiences and the experiences of the Latino community navigating COVID, which is very particular in many ways. We completely failed the Latino and Latinx community. And so we hate that, but we are very excited to have Patricia here to share those experiences with us and to share more about what we need to do to support the community.
Doña Patricia, si usted quiere hablar en español, es ok. Yo pediré a todos los demás que usen el icono para que usen la traducción en inglés. So if you would like, you can use the English icon for you to hear what Miss Patricia has to say. Puede usted empezar, señora Patricia.
Hola, buenas tardes. Mi nombre es Patricia Obregón y soy trabajador comunitario de la salud y también soy madre de 4 niños. Pues yo me vacuné en parte por mi trabajo y mi hijo el más pequeño tiene asma, y cuando supimos que la vacuna no iba a ser accesible para ellos, esto también fue un motivo para que nos vacunáramos. En mi casa el único que no está vacunado es él. Yo la semana pasada recibí la dosis de refuerzo también. Y pues, al igual que Maya Jackson, la mayoría de los latinos que no se habían vacunado se están vacunando porque perdieron un familiar, o es triste decirlo, porque uno los ve y vienen y te dicen, oh, vengo y me vacuno porque se murió mi mamá o se murió mi papá, o en casa todos tuvimos COVID y perdimos varias personas en la familia. Y pues ahora que está habiendo vacuna para niños, nosotros estamos diciéndole a las familias, vacunen a sus niños, porque ellos se quejan mucho de que tienen que dejar de trabajar porque ponen a los niños menores de 11 años en cuarentena porque no están vacunados cuando tienen contacto con alguien. Y eso de alguna manera los está motivando a vacunarse ellos y buscar más información para vacunar a sus niños. Yo me puse Moderna, mis primeras 2 dosis, y yo con la segunda dosis me fue un poco mal. Tuve fiebre, náuseas y dolor de cabeza, pero con la dosis de refuerzo que me puse el sábado pasado, que fue Pfizer, no, solamente tuve un poco de fiebre. Pero en mi familia, las 4 personas más que se vacunaron, que son 3 adolescentes y mi esposo, ellos solamente tuvieron dolor en el brazo. Y pues yo invito siempre a todas las personas, les cuento un poco de lo que ha pasado en mi familia y de todas las personas en la comunidad que se han vacunado con nosotros, porque en mi organización también los ayudamos a buscar un lugar donde vacunarse. Y hay veces vienen personas y nos dicen muchas gracias porque en mi casa ya todos están vacunados y no nos ha dado COVID, o hay personas que tienen COVID y después del COVID nos llaman para que se vacunen porque no quieren volver a pasar por lo mismo, y ellos mismos transmiten el mensaje, o sea que es mejor que se vacunen y sentirse dolor en el brazo o fiebre por 1 o 2 días que estar de 2 semanas a 1 mes en cuarentena porque toda la familia se contagia con COVID. Y muchas gracias por el espacio y por tomarme en cuenta a mí y a la comunidad latina.
Muchísimas gracias. Thank you for sharing very much, Patricia.
Y muchas gracias al intérprete que hace muy buen trabajo también.
See, most definitely. Thank you so much. We uplifted that those who are watching us on Facebook, if they do not have access to interpretation, Patricia gave us a really wonderful story about her experience, and I don't want to take away from it, but I'm gonna try to paraphrase it quickly. Patricia was able to get vaccinated, both shots in the booster, did it for her kids. Initially, the kids were not able to be vaccinated, but since they're out in the community, they took that step as what they felt for their family would keep them safe. Patricia did experience the body aches, the fever, the nausea, especially from the second shot. And when she received the booster recently, experienced a low-grade fever. Her family members did not experience all of these symptoms that she experienced, but overall, they are more glad to not have COVID, to not be quarantined for a month or more at a time. And they feel that it was the best choice for their family and a beneficial experience. And Patricia does a lot of work for the community and helping other people, especially now, gain access. And unfortunately, she mentioned that the community shares a lot of similar experiences, like my Jackson experience with loss of family members due to COVID. And so a lot of people are not wanting to have that same experience anymore and wanting to get their vaccines after either getting sick or seeing a family member get sick. So they're seeing increased interest, and she's helping to get people the access they need if they decide that they do want to follow through with getting the vaccine. So thank you so much, y'all, for sharing y'all stories. Thank y'all for hanging over. I do have one last question if people have just a few more minutes. From Dr. Small, Dr. Erickson, Dr. Viviana Martinez, what are a few tips, if each of y'all could share 1 or 2 tips, even, let's say if vaccine or not, if you say nah, if you say yeah, but what are some other things that we can all do to stop the spread, stay healthy, stay safe?
The 3 W's and the 3 M's. So the wear your mask, wash your hands, and wait 6 feet. And en español, manténgase la máscara y ¿qué es el otro M?
Lávese las manos y
Lávese
mantenga
las
la
manos.
distancia.
Y manténgase 6 pies separado. Other things?
I think we forget, we are thinking that we're outside of the pandemic, and we still have 70,000 people per day that continue to get COVID in the United States every day. We continue to see, I've been working with Patricia Obregon and their team doing rapid testing for the community. We continue to see people testing positive every day. We have to remember, if you're going into a mall where there are lots of people, wear your mask, protect yourself. By protecting yourself, you're protecting others. And the last thing I want to say is there are little kids younger than 5 years of age that do not have access to the vaccine right now. The best way to protect the little ones is as adults getting vaccinated, wearing our mask when we're outside and exposed to others, and also vaccinated the older siblings who are older than 5 years of age. That is very important if we want to protect the little ones from getting sick.
That's it.
I will agree with both of those statements. And when possible, if you're able to be outside for gatherings instead of inside, as the weather cools down, that gets harder and harder. But there are still lots of ways that we can be outside, especially during the daylight hours when it warms up still a lot here in North Carolina. And I think also just, again, remembering that we do have a significant number of children, as Dr. Martinez Bianchi said, who cannot be vaccinated yet, or for people who have chosen not to receive the vaccine. One of the best ways that we can protect them is for us to wear our masks. And so just reinforcing that message as well.
And I think the last thing is community, and that also means being careful and mindful of each other, caring for each other, like we're doing here.
Yes, and Mr. Wright uplifted to wear your mask properly over your mouth and over your nose. And then I'll add to wash your hands properly, sing your ABCs, hit the bag in between your fingers. But thank y'all. Any parting words from any of our panelists as we close out?
Thank you. Muchísimas gracias, todo el mundo.
Just one quick word. I know as communities of color, we have a history of distrust, and we definitely have a right to distrust. But there are people of color who were key developers in this vaccine. We have providers like Dr. Small and Viviana who have been doing amazing work, and we need to trust their expertise and trust that if you need to sit down and ask questions because you're not quite sure of what to do, that there are going to be people like them available to talk to you to make the best decision for you and your family. So again, we want to acknowledge the historical atrocities that have happened within public health. But right now, as communities of color, we have to empower each other to make the right decision to protect all of us.
Thank you.
Yes, ask the question, get the information, and make informed decisions. We appreciate y'all.
Thank you.
Thank you for everything.
Thank you.
Bye.
Bye.
Bye, y'all. Have a great